back to TV5 News at 9. It is now time for Medical Moments with Covenant Healthcare. Today we're talking about heart disease. With me today is nurse practitioner Rachel Bryant. Thank you so much for joining me.
Thank you for having me.
Okay, so February we all know is Heart Month, very important month, and we're discussing today focusing on heart health and specifically heart disease. So tell me a little bit about coronary artery disease first.
So coronary artery disease is essentially when we have a lot of plaque buildup in our heart. Okay, so what does that mean? That if you think of the arteries that feed your heart as plumbing pipes. So if those pipes get filled with a bunch of gunk, that can narrow the pipe into a nice circle and it can narrow it down. If that gets too narrow, that's what we can lead to heart disease, heart attacks, things like that.
Okay, so what is it that, what are some factors that put people at risk and increased risk for heart disease?
So we have what we call modifiable and non-modifiable risk factors. Our non-modifiable are things that we just can't change. So that's going to include our age, race, genetics, family history, things like that, which just we can't do anything about.
Yeah, but there are some that we can control. So talk to us about those that we can do something about.
Yes. So yes. Well, I told you the stuff we can't change. Thankfully, there are a lot of things that we can change, and we call those modifiable or changeable risk factors. So that's going to be if you have a high blood pressure, making sure your blood pressure is under control. High cholesterol. That is, we have a couple different types of cholesterol. We have our LDL and our HDL. Again, like what does that mean? LDL, I think of it as our lousy. That's our bad cholesterol. That's going to basically clog the drainage pipes. Reducing our fast food intake, watching just those really high fat foods can help kind of combat that. Also, we have our HDL, and I think of that as happy or heart healthy cholesterol. That's going to be things that will help protect the piping, and that can be like foods like avocado, nuts, fish. That's all going to help increase our HDL.
That is so easy to remember because you always hear about HDL and LDL, and now it's like happy and then lousy.
That's how I always have to make things as simple as I can when I'm learning things. And then a couple other risk factors that we can change if we're inactive. So, and I'm not saying like, all right, go out and run a 5K or start CrossFit today, but go out for a walk, 30 minutes a day. Go at the mall, walk around the mall. When it gets nice outside, walk, on the sidewalk, get that sunshine. That can help, decrease our risk. Being overweight, especially morbidly obese, we carry a lot of weight around our middle. That will increase our risk of developing that artery or plaque buildup. So whatever we can do to drop our weight, actually eating healthy, physical activity will all help with that. And then really two of the other really big ones will be stopping smoking, which we all talk about, but smoking puts you at a very big risk factor. So whatever we can do to stop that, even if you cut down a cigarette one a day, that will eventually get you to 0. And then if you have diabetes, that's another really big risk factor for coronary artery disease. So going to the doctor, making sure our blood sugar is under control. And it doesn't matter if you have type 1 or type 2 diabetes, that puts you at risk either way.
So there are a lot of things we can control. I like that. Eating your fruits and veggies, like you said, walking, even just like you were talking about, you're at the mall, park a little farther back to walk.
Anything going, really, like you said, and it's hard in the winter because it's cold and it's yucky, but like I said, going to a mall, there's a lot of different things around the community that you can help with, there's center courts, other things like that.
So for Heart Health and February Heart Health Month, what else would you like to tell people about with heart disease and prevention?
Absolutely. So I think what you said, prevention is going to be one of the biggest things. So everyone talks about going to your doctor every year, and I think a lot of people don't do that because, like, well, I feel fine. But high blood pressure, high cholesterol, diabetes, those are all things that we can find if we do this yearly preventative medicine exam, and really staying on top of that.
I love it. Rachel, tell me about it. Why you love working with the patients that you do.
There's so many reasons. I think the big thing I love about my job is that I'm able to help people understand what's going on. So my grandma unfortunately had a different type of heart problem, symptoms, and I remember she just got very frustrated and overwhelmed with everything that was told to her, and that was with myself being a nurse at the time. My mom is a nurse, so we were fortunate we had people that could help explain things,
right.
But not everyone has that. So if I'm able to help someone understand what's going on with them and also kind of take ownership of what we can do to help make it better, that is one of my biggest goals of doing what I do.
And you know, you have that something special about you because you make it easy to understand what you're saying. That I'm telling you that HDL, LDL, it's so hard for people to understand that. So happy and then lousy.
Yes.
Okay. Thank you so much.
Thank
we
you.
appreciate you joining us today. If you would like any additional information on today's topic, just head on over to the Hot Links page on WNEM.com.